The World Health Organization tonight is declaring Mpox, formerly known as monkeypox, a global public health emergency as a new form of the virus is now rapidly spreading across Africa. Cases have been detected in more than a dozen countries, most of them in the Democratic Republic of the Congo, with more than 14,000 cases there, 524 deaths this year alone. Here at home, the CDC is urging doctors and the public to be alert for signs of the virus, including fever, muscle aches, swollen lymph nodes. Dr. Ashke Sayal is joining us now. Doctor, how big of a threat is this in terms of a global perspective, and what does this global health emergency declaration really do from a practical standpoint?
Hey, Tom. So this is actually the second time in 3 years the WHO has declared a public health emergency over Mpox. And what we're seeing now is, yes, the cases are largely in Africa, specifically in the DRC, the Democratic Republic of Congo. But the reason they're calling this out now, Tom, is that it's actually leaking out into neighboring countries. And, Tom, this is a different strain than the Mpox outbreak we saw a few years ago, including here in the U.S. This one has a fatality rate about 15 to 30 times higher. It's significantly more deadly than the other ones. So you can see the WHO is acting quickly here. And the PHEIC, the public health emergency, really calls for nations to start sharing resources. Vaccines, treatments, research can be really, really useful for those poorer countries. And you can see here a statement, Tom, we just got in the last hour from HHS, saying that while the CDC, yes, saying the public should be alert, right now the threat is very low here in the United States, but people should nonetheless be on the lookout for this thing, for this virus, and to stay alert for those symptoms that you mentioned earlier there, Tom.
Hey, doctor, as we were talking about the symptoms, I thought, are we missing one? In other words, I thought that one of the symptoms with monkeypox anyway was kind of a severe blistering type of thing.
Yeah, it was that rash bullet on there you can see in the bottom right. It's very typical of Mpox. When you see it, you can't really miss it. But those other symptoms you mentioned, fever, chills, exhaustion, odds are if you're having those things, it's probably something else, including the flu or maybe even COVID. But the rash really is the hallmark symptom, Tom, that blistering rash you mentioned, yes.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.